I just choked on my own spit. And if you choke on your own spit, if you are coughing, if you are laughing, if you are moving in the car, a pillow to brace that abdomen is going to be so beneficial. Hello to all of you beautiful birthing people. Welcome back to my channel. My name is Elizabeth. I am a labor and delivery nurse, certified childbirth educator, and mom to 3. And today I am coming at you with a video that when I went back and looked at all the videos that I have on cesarean birth, I found to be just a little bit lacking. We need a video dedicated to cesarean birth recovery. So these are all of my tips for the hospital and for when you go home. And I even, because I haven't personally had a cesarean birth, put up a question on Instagram for you guys to share your tips as well. So if you're not following me on Instagram, go on over and do that. And don't forget to like, comment, and subscribe to my channel if you want to, so that you can get more tips for labor and birth. And if you don't know what kind of birth you're going to have, which most of us don't going in, this video is still going to be helpful because a third of births in the United States are via cesarean birth. So let's go ahead and jump into it. Now, the first thing that I want to talk about is that we have a new protocol, and this protocol is actually across the board for like surgery in general, and it's called ERAS. And what that stands for is Enhanced Recovery After Surgery. And what this whole policy does is it is a way for us to both before you come to the hospital, at the hospital, recovering after surgery, and when you go home, decrease our risk of complications after surgery. So by following this policy, what we are trying to do is decrease the risk of constipation, weakness, blood clots, pneumonia, pressure injuries on the skin that we can see after surgery. And how we're going to do that is early mobility and frequent walking, choosing non-narcotic pain options as we can, chewing gum, incentive spirometer, and breathing exercises. And all of these things work really, really well with a cesarean birth, with cesarean birth recovery, and even helping with getting your pelvic floor and everything kind of working back together. Because a lot of people think, oh, if I've had a cesarean birth, I'm not going to have pelvic floor issues. But more than the birth itself, pregnancy and that extra load of the pregnancy, and then also having a cesarean birth and having 7 layers of muscle, fat, fascia, everything cut through, we are going to see potential for pelvic floor injury or a potential for pelvic floor weakness that we do want to address. So one of the things from ERAS that my hospital does that you can do even if your hospital does not follow this policy, right after you've delivered your baby in the PACU, start chewing a sugar-free mint gum. And what this does is it helps turn your digestive tract back on. When we've had a cesarean birth or any sort of surgery, particularly when we're talking about surgery that's near your stomach and your intestines and all of those good things, there's the potential to have some slower gastric emptying, to have your GI tract slow down a little bit, which can lead to nausea, vomiting, and that leads to excess gas, constipation, all sorts of things we want to avoid. So chewing gum immediately post-operatively can help. The other thing that it's really important for us to do is to keep up on our pain medicine. And this is going to be both immediately post-operatively in the hospital and at home. Now, some places at the hospital will have your non-narcotic pain medications scheduled. And if we keep those scheduled, we can avoid our pain getting to the point where we need a narcotic. Now, obviously, if you need a narcotic, we want you to take that narcotic because we want you to be able to move. But if we have scheduled non-narcotic medications, then we are just dealing with breakthrough pain with the narcotics as opposed to waiting for the pain to get so intense because we haven't been keeping up with our scheduled pain medication that, whoop, all of a sudden, now I have to have a narcotic, and that becomes a cycle of waiting too long in between. After you've had your baby, it's important to ask, are my pain medications scheduled or are they PRN? PRN means as needed. And often if they're PRN, that means that you have to ask for it. So how can you help remind yourself to ask for it? You can ask how often you can have them and set a timer on your phone. That's probably what I would do so that you are able to call out and ask your nurse. Depending on how busy your nurse is, depending on what your nurse's day looks like, they might be able to remember, okay, she wanted pain meds at 4 p.m. But if at 4 p.m. there's something else crazy going on, it's really helpful if they are not scheduled that you ask for those pain medications so that we can make sure that you are staying as comfortable as possible, reducing your narcotic use. Because why do we care about narcotics? Narcotics are great. I want them if you need them. but they are incredibly constipating. So it's best for you if you can get off of them as quickly as possible while making sure that you're not in too much pain. The other thing, since we're talking about constipation, that I think goes really well hand in hand is that we take stool softeners. So our stool softeners are sometimes scheduled, sometimes as needed. You can have a stool softener twice a day. Typically we do Docusate or Colace once in the morning and once at night. This is so that when you do go, your poo is nice and soft. It doesn't make you go too early, and don't be surprised if you don't go to have a bowel movement till about 3 or 4 days postpartum. If you feel like you need to go and you can't, that's when you can talk to your provider about adding some sort of gentle laxative, or my personal favorite, an OB cocktail, which is prune juice, a little bit of apple, a little bit of orange, all warmed up together to make a delicious hot apple cider-esque beverage for you. So speaking of constipation, let's move on to gas. One reason why it's really beneficial for you to get up and walk the halls the same day that you've had your surgery, and you're like, what? I just had major abdominal surgery. But this policy is actually for all sorts of surgeries. So somebody who's had a hip replacement or a knee replacement, they might be getting up and walking the same day too, which I've never worked on those units. That sounds crazy to me, but we have the evidence to back up that this is beneficial. Getting up and walking early reduces your risk of having trapped gas that is potentially excruciatingly painful. So when you have gas that is trapped in your abdomen, often this pain refers up to your shoulder, which can be really scary because in women, often we see shoulder pain associated with like cardiac injury or heart attack. And so you're like, my shoulder's hurting really, really bad. Often it's gas. So if we get up and move that same day, if we do all of our meals in the chair, which means we've moved to the chair, if we've walked the halls, all those things can help reduce the risk of having gas trapped. If you have gas trapped, if you have a painful shoulder, heat is a great thing to use to help with that. On our incision, to help with swelling and to help with discomfort, ice is a great thing to have for that. So as far as getting up and taking a shower, that is something that is probably going to make you feel incredibly human and amazing again. So often we do our shower the day after surgery when you've gotten up and walked a few times, and you take a nice, beautiful, luxurious shower. You use antimicrobial soap around your incision is the recommendation there. And then after that, you need to make sure that your incision gets as dry as possible. This, for some people, they'll have like a big gauzy dressing over top. Often that comes off in the first shower. For other people, they might have a Tegaderm or a thin plastic dressing over top, and that often comes off right before you go home. After you're taking a shower, it is really important, if your incision is open to air, that you are getting it as dry as humanly possible. Somebody recommended, and I really liked this, using a cotton t-shirt that's nice and soft to really get that area nice and dry. If you have a pannus or a belly that hangs over a little bit, I even love using like a hair dryer. A lot softer than those really horrible towels that we have in the hospital. You can even ask for a baby blanket in the hospital to get things nice and dry. I just choked on my own spit. And if you choke on your own spit, if you are coughing, if you are laughing, if you are moving in the car, a pillow to brace that abdomen is going to be so beneficial. One of you guys recommended using your boppy to do this because it's actually perfectly shaped, and I love that. I don't really love the boppy for breastfeeding. I don't feel like it gets baby up high enough, but it's great for tummy time for baby, and it's great for protecting your tummy, your incision, in a bumpy ride or a coughing fit or a laughter fit. When we're talking about breastfeeding with a cesarean scar, it is important to know that there might be some irritation if you've got the breastfeeding pillow right on that scar. So I really recommend skipping the breastfeeding pillow. Doing some laid back nursing can be a really good way. Also lying on your side lying nursing, depending on how that feels on your scar. The other thing that you can do is get a breast friend. That's the one that clips up a little bit higher so you can clip baby off of the incision, or a football hold, or all things that you're going to want to explore. Definitely chat with a lactation consultant, with your nurses who are helping you breastfeed in the hospital, to find positions that are most comfortable for you for feeding your baby. And then the next thing that I'm going to tell you, I think is really, really, really beneficial. You're going to have nurses and doctors coming in the hospital and assessing your incision and telling you, oh my gosh, this looks great, this looks beautiful. And chances are you maybe haven't seen your incision. Often the mirrors in the hospital aren't the right height for you to see your incision, especially if you're on the shorter side. You might still have a little bit of a belly or a pannus that hangs over where you can't really visualize your incision. So what I would recommend for you to do is either you take a picture or have your partner take a picture. And if this is something that's triggering for you and you're like, I don't want to see my incision, that's okay. Know that that's okay and normal. Okay, know that that's okay. Have your partner take a picture so that they know what it looks like, okay? Things that are really normal that we don't see because we don't see fresh post-op C-section incisions often. Bruising around the incision site is really, really, really normal. A little bit of dried blood, maybe some steri strips on the incision, maybe some other things that we might see is like a little bit of like swelling around that area. So all things that are really, really normal. But if you get home and things feel a little off and you look and you're like, oh my gosh, it's so bruised around it. Well, who's to say that it wasn't bruised around it when your nurse and your provider were telling you that it looked beautiful? So that's my recommendation. It's not even that you have to look at it if that's something that you can't handle doing right now, but have your partner take a picture saved on their phone. That way, if you are having issues or concerns, you can always refer back to that picture. Or just you can always go in and see your provider. That is also always okay. Because things that we do worry about with an incision is if it gets really red or hot around the incision site, if you get a fever, if we have any excessive discharge from it, particularly if that's like a pussy discharge, or if it opens back up. Those are all things that we definitely want to see our provider for and get addressed because there might be an issue with an underlying infection or just a need for an extra little like steri strip to kind of close things back up. So when we're talking about that early ambulation, things that might make you feel more comfortable are having an abdominal binder. That's something that might be offered to you in the hospital. High-waisted legging might feel really comfortable. Some people don't really like the feeling of having anything on their incision, so making sure that you have some high-waisted underwear that's not going to rub on the incision because that incision will be right on your bikini line, or having a loose flowy dress might also be a good option for going home. With cesarean births, we often see that you've gotten a little bit more IV fluid and there might be a little bit of swelling associated with that cesarean birth, so getting compression socks and stockings might be beneficial for when you go home. I also think it can be really, really helpful to do some Epsom salt soaks for your feet in the bathtub during recovery in all the free time that you have, right? But it can really feel good if you're having a lot of extra swelling. When you go home, I think it's really important that, you know, you're still going to be getting up and moving, but that you have a station downstairs and a station upstairs. If you have multi-levels, that kind of has all the supplies that you need for taking care of baby, for breastfeeding, for taking care of yourself, pain medications, hydration stations, snacks, so that you're not having to go up and down the stairs a whole bunch unnecessarily, and that you are being really cautious when you are carrying baby up and down stairs. And that goes really for any type of delivery. We want to make sure that we are being safe at all times, because when you've had a cesarean birth, we don't want you picking up anything heavier than about 10 pounds, so about the weight of your baby. And so that kind of keep that in mind too. If you're putting baby in the car seat, it might be more beneficial to put the car seat in the car and then go put baby in the car seat, versus carrying baby in the car seat would be too heavy for you in the first few weeks post-operatively. One concern that we do have when you have any sort of surgery is that risk of pneumonia. And so your nurse will more than likely provide you with an incentive spirometer. And if they don't, just ask for one. With an incentive spirometer, what you do is you place your lips on the incentive spirometer and take a really nice deep diaphragmatic breath in and try and open your lungs up as much as possible. And this does two things. One, it helps reduce the risk of pneumonia, but two, those nice deep diaphragmatic breaths gonna kind of help your brain and your pelvic floor all reconnect. So being really conscientious of when you're taking that breath in, your pelvic floor feels like it's lengthening. And then when you exhale is going to be beneficial in reconnecting those areas. And those are some pelvic floor exercises that you can start in the immediate postoperative period or immediately after a vaginal birth as well. And then when we're talking about sleeping at home, it's great if you have a bassinet that's up at the level of the bed. I was a big fan of the Halo bassinet, which actually brings the bassinet and it's at the level of the bed so that you're not having to reach down and pick baby up. But if you don't have a bassinet like that, that is where partners, you are going to be our baby retrievers so that we can just focus on feeding baby and not focus on getting up out of the bed. But I am really quick going to show you a way that you can easily or more easily get out of the bed if you've had a cesarean birth, because we have had some layers of muscle and some layers of everything else cut through. So pardon the clothing change and the unmakeup appearance, but I want to show you guys real quick how to get out of the bed if you have had an abdominal cesarean birth. So when we're in bed, if I was going to get out of bed right now, I'd sit up, I'd get out of bed. That's going to be a no-go. That's going to be really, really painful and uncomfortable. So you're lying, sleeping in the bed, baby wakes up, you need to go to the bathroom. What are we going to do? We are going to roll to the side, and then we're going to use this top arm to to push ourselves up. You can use that bottom arm to kind of brace your incision, and use that top arm to push yourself up and over, and then walk on out of there. The other thing that I want to say is give yourself grace, give yourself time to get up, and when you are up and walking in the hallways, using your baby's bassinet in the hospital to push is a great little walker to give you some extra support when you're up and moving right after you've given birth. Then the last thing that I want to touch on that I know there's not as much talk about, and this wouldn't occur maybe immediately in the hospital, but something to think about in those weeks that you're recovering, is scar desensitization and scar massage. So desensitization is when you're going to start with different kinds of fabric, maybe like a cotton ball, maybe different sensations or feelings, and you're just going to rub those along your scar, because often that scar has a little bit of altered sensation or weird sensation, and we just want to kind of start connecting our brain and our nerves and everything back together, and also processing potentially the birth that we had that maybe wasn't exactly what we were thinking. And then scar massage, that we can start at about 6 weeks postpartum, is when you are going to just massage around the scar and at the scar to help break down any adhesive tissue that's going to form at that area, to help that scar lay more uniformly, to help that scar heal up better. You might use a little bit of vitamin E oil with this, or anything else that your provider recommends to help that scar heal up, are all things that we can do, and that's going to help make sure that that tissue is nice and supple, and you have less issues with like skin puckering, and less issues with having like a shelf, and help with healing and everything else there. And of course, again, seeking out a pelvic floor PT if you're having any symptoms of pelvic floor dysfunction, issues with urinary, bowel, sex, anything in that whole pelvic floor region. It can be really beneficial to seek out a pelvic floor physical therapist. The last thing I want to touch on is just emotionally, and I've kind of touched on it throughout this video. Cesarean birth is not often something that we go in planning on having. So talking about your birth, debriefing your birth, processing your birth is going to be something that's really important, whether you do that with a trusted friend, with your physician, with your nurse, with a therapist, which can all be really important in kind of taking this birth experience and putting it into our brains and processing it in a positive way versus a negative way, because you are an amazing parent for your baby. You gave your baby life. You had an abdominal surgery, which is a huge deal, and your baby is here and healthy and safe, hopefully. And I just want to commend you for giving birth to your baby and being the amazing person that you are. So I hope that these tips were helpful. Definitely, if you have any other tips, leave them down below. And until next time, bye guys.